probably the majority, that even a principle say, you know what, it's not even about the money. It's about the principle. It's about, I serve the country. I put my time in. I, blood, sweat, and tears, sacrifice for this country. And you told me I was going to get health care for the rest of my life. And now you're telling me you're going to penalize me if I don't take Medicare. I feel some type of way about that. And just by merit, I'm not gonna take it, or I'm considering not taking it.
Yeah, I get that.
Basically swearing to my own hurt and not changing.
Exactly. And while I completely understand that frustration, believe me, I mean, as I've referenced my personal situation, not only having VA healthcare, but also TRICARE, knowing that in order to just continue receiving that benefit, I'm going to have to enroll in Medicare and pay 5 times, as of right now, this year, the premium what I'm paying for TRICARE, knowing that down the road is going to be much higher than that, if it's still around, right? Just to continue receiving that benefit. Believe me, I completely understand that line of thinking. But the reality is that worth your pride? Is that worth you paying completely out of pocket, out of your own money that you've been saving for 20, 30, 40 years to enjoy in retirement? I would argue, no, my pride is not worth that. At the end of the day, the VA on their public-facing website recommends that all veterans enroll into all forms of health care that they have available to them for very specific reasons. They lay it all out. They don't want you to be restricted to only one source for your health care, and that's huge. They know that they have limits. That's what they're recognizing. They know that they can't provide adequate care in some spaces. And so they're going to say, you should have the option. They want you to have the freedom. Not because it's going to cost you more. It's going to cost you more to not have the coverage when you need that, right?
Right.